Welcome back. If you just joined us, you're watching the news at 10 live on Channels Television Lagos. A reminder of our top stories. NCDC confirms 14 new COVID-19 cases in Nigeria, bringing the total number of confirmed cases to 111 as President Muhammadu Buhari announces lockdown in Lagos, Abuja and Ogun states as precaution against spread of the novel coronavirus. Chief of Staff to President Muhammadu Buhari, Alakijas, confirms testing positive to the coronavirus, says he will be moved to Lagos for further treatment and will resume work soon. Chairman and Vice Chairman of Fanfa Oil, Modupe and Folorunsho Alakijas donate 1 billion naira to support government's efforts at fighting COVID-19. And the UK's health authorities say it may take 6 months before life returns to normal in the UK following the outbreak of the coronavirus. Our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV apps for Android and iOS devices from their respective stores. As cases of COVID-19 continue to rise in the nation's capital, many churches are complying with the order from the FCT minister to shut down places of worship in the Abuja Municipal Area Council. And in order to begin fumigation of parks and markets, our correspondent Kayla Megwa has more. We will soon have that report from Kayla. Meanwhile, there are calls for everyone to be more vigilant at this time. The Inspector General of Police, Muhammad Adamu, is asking Nigerians to be wary of criminal elements that are planning to take advantage of the emergency situation created by the COVID-19 pandemic to perpetrate cybercrime. A police chief's warning comes on the heels of a series of intelligence gathering which suggests fraud and cybercrime are expected to rise at this time owing to the lockdown in place by several state governments to contain the coronavirus pandemic. The IGP says intelligence reports from Interpol headquarters show that scammers in Nigeria and other parts of the globe are setting up fraudulent websites and e-commerce platforms, among others, to sell and deliver COVID-19 medical products using names of prominent companies involved in the production and distribution of these items. The IGP therefore enjoins the public to be discerning when dealing with suspicious emails and clicking on links in unrecognized emails and attachments. All hands are indeed on deck to beat the coronavirus in Nigeria. The latest of such efforts coming from a chairman and vice chairman of Fanfa Oil Limited, Modupe and Folorunsho Alakijas, who today announced a donation of 1 billion naira to support the fight against COVID-19 in Nigeria. According to them, the donation symbolizes their resilience, character and strength as they plan to work with various organizations in the country in actualizing their dream. Some of the beneficiaries of the donation include the Nigeria Center for Disease Control and the Lagos State Government, which will get 250 million naira each. The Africa Center for Excellence for Genomics of Infectious Diseases will get 50 million naira, while medical workers on the front line in Lagos and in Abuja will receive 100 million naira each. The supply of medical equipment to relevant organizations will get 245 million naira. The Dr. Mayor Stella Adadevo Foundation is also one of the beneficiaries of the donation. We have joining us now on the news at 10, the immediate past Commissioner for Health in Ogun State, Dr. Babatunde Ikpaye. Thank you for joining us on the news at 10. I suppose every doctor has their hands on deck at this moment, so we do appreciate your being here. First of all, your thoughts on the lockdown, coming too late or just at the right time?
Good evening, Amarashi. Good evening, Nigerians. Let me let's start by saying big thank you to President Buhari for doing the needful today. This is coming a bit too late, but of course we have gotten to a position where we needed to do the needful. I'll tell you straight. that 3 countries have been able to flatten the curve globally.
Yeah.
China did a lockdown. South Korea actually did mass testing. And of course, Czech Republic has been able to get everybody to wear a mask. So for us as a country with a very fragile system, we need to do the 3. And I'm happy that Mr. President actually came out strongly today.
Yeah, but you heard the NCDC Director General who said the major challenge is getting people on board with understanding what the virus is about and to realize that, this is really important. We really need to do what we can to keep people safe.
Dr. Chiku is my very good friend. We discuss this all of the time. You know that Nigeria is a country where we socialize a lot and where extended family network is the hallmark of our everyday life. So actually changing the behavior of people from those who socialize to solitary confinement is not going to be an easy thing to do. But I guess what we need to do is to cooperate with government, and because this is what we need to do. And for public health's sake, we must obey everything that the government has said, and everything the president has said today, because for us, that's the only way to go. If you look at the number of cases in Nigeria, it is not possibly reflecting the burden of COVID-19 in Nigeria, because we are not doing enough tests. Imagine what will happen if we have thousands of tests conducted daily like it is done elsewhere. The number will be multiplying, and so we need to do something, particularly in Lagos and FCT.
Yeah, and 3 major cities that the president mentioned, Lagos, Ogun, and Abuja. I know that these are major commercial and government nerve centers. Abuja, of course, being the FCT, Lagos being where goods and services come through the seaports and a lot of markets and so on. How do people really stay safe? Because I know the challenge here is keeping people at home, but even while they're at home, how do they stay safe? Because you still have other people in the house. How do you get everybody on board with washing your hands and using hand sanitizers and stuff? Some people don't feel they can be sick in their own homes.
Well, unfortunately, we have a global pandemic which has become an epidemic in our own country that is ravaging not only the world but it's ravaging Nigeria as we speak. But Nigerians need to know that this is a period where everybody needs to play a part. This is a time where doctors, nurses, the political leaders, philanthropists, and everybody, including my grandma in the village, need to play a part. Yeah. And if we do not do the needful, okay, what we do is that we are going to create a rural epidemic, right? Because the community level transmission suggests that while we have the epidemic within the cities, Abuja and Lagos, the advantage we have is that most of the old people in Nigeria don't live in those cities, okay? And that is why the case fatality is still very manageable. The moment we allow, this to spread to the rural communities where most old Nigerians live, then we are going to have a big catastrophe in our hands. So if restriction is the way to go, okay, we should, as a matter of, national duty, agree with Mr. President and, of course, the public health experts like myself that what we've been preaching, and that is the only way to go for now. And the moment we do that, we're able to contain this epidemic.
Yeah, and I think it's important what you're saying, because a lot of people are scared watching the news. They see the numbers rising in other countries and, people are just...
No, if you look at the numbers, the way the number rises is such that if you look the first 64 days, it took 64 days for the first 100,000 to be multiplied, okay, to be replicated. It took another 14 days for that to be doubled. It took 4 days to double it. And in the last 5 days, it's been taking just about a day or 2 to have additional 100,000 added globally. Between 2 days ago and today, we are having almost 200,000 cases globally. So the implication of that is that if it happens in a country with a challenging health system, then we won't have a system to cope. We won't have a system to cope. So the only thing we could do as a nation is to aggressively, pursue the preventive option, i.e., we need to have lockdown at epicenters. 2, we need to take, personal hygiene very serious. And secondly, I'm putting this forward. What Czech Republic have done is that everybody that is exposed wears masks.
Wow. It's pretty interesting, and I think we're more at ease now, with you explaining it this way, Dr. Babatunde Ekpaye. Thank you again for being here on the News at 10. Really, really appreciate it.
The pleasure is mine. Thank you for having me.
When the News at 10 returns, Israel evacuated citizens and embassy officials from Nigeria as part of efforts to protecting her citizens from contracting the coronavirus. Please join us again.